Good morning. Dr. Warren is here, and this is one of our most important vlogs because we want to talk about the vaccine and some misconceptions and maybe some misinformation in the media about what the schools actually can do regarding getting vaccine to our professional staff. Good morning, Dr. Warren.
Good morning. Glad to be here, and of course, glad to be talking about such an important subject. We have been working actually with some of our local pharmacists who have contacted us regarding the vaccine, and what everybody needs to understand, number one, Arkansas did not receive the number of vaccines that was anticipated. And number two, it's left up to the pharmacists to get those vaccines, and then based on the number that they get, they contact us. I have X number of vaccines. So there is no per se plan as to how the vaccines are going to be administered across the state. We want to just help them, help our staff.
So again, just to be clear, so the superintendent, assistant superintendent, or principals aren't in charge of getting the vaccines. We're actually being called through your office if they are available.
Absolutely. That was never part of the plan for the school district personnel to be responsible for the vaccine. We don't even know as school employees when the vaccine arrives in the state. So the superintendent would have no way of knowing what vaccine, the number of vaccines. That's strictly through the pharmacists in the state.
But what we have done through Dr. Warren's leadership is we have a communication hub where pharmacies can call her, hey, in this location we have some vaccines available that we didn't expect. Now, Dr. Warren, would you suggest to our employees, if they get a chance to go to their local pharmacy and get a vaccine, get the vaccine?
Definitely go to your local pharmacist if you get that opportunity. We're just working with them to try to get what we can here. And the other piece I want to make sure that we mention here is that when a pharmacist contact us, we look at the area of their location, and then the other piece is we look at the number of employees in that particular building have voiced an interest wanted, and we try to compare those numbers to make sure that vaccine isn't wasted.
That's it, because we do not want to waste any vaccines.
Absolutely not. The other piece, once you have that first dose, they will give you a card. That card will have the date that you need to take that second dose, and make sure that you make arrangements, our employees, to get that second dose at that same location, because it will need to be the same vaccine.
So again, second dose, same location, and they've given you a date. Thank you, everybody. Have a great rest of the week.